What are some pros and cons of genetic testing?
Genetic testing can be beneficial for children with epilepsy in a number of ways. I think most importantly, it can guide medical management for children. So if your doctor knows the underlying cause for your seizures, it helps them make decisions about your care. So in some cases, with some genetic diagnoses, it informs which medications are best, which ones might not work as well. It can also provide some insight into the effectiveness of certain dietary or surgical options. So for families who are considering those things, it can also provide some insight into prognosis. So what do we expect seizures to look like over time? Are there any other symptoms that might arise in the future? Genetic testing, so once you find that underlying cause, it can also avoid needing to do further diagnostic tests. So that can be helpful for some families. And then a lot of families, especially who come for genetic counseling, are wondering, if we have another child, what's the likelihood or the possibility that they're going to have the same condition that our child with epilepsy has? Yeah. And so some genetic test results will let us know that. And then also knowing your genetic diagnosis can also be necessary for inclusion in certain clinical trials or research. And then also knowing your genetic diagnosis also gives you the opportunity to join advocacy groups that are specific to whatever diagnosis your child has. And those advocacy groups are really great for both emotional support, but then also practical resources, because these are parents who are going through the exact same thing that you're going through.
Absolutely.
And I think lastly, but not least, a lot of families say that learning the underlying cause for their child's medical history has a really meaningful psychological and emotional benefit. Gives them some insight into what their child's going through, to what the cause was. So that can be really helpful for some people.
So what are some cons then to genetic testing?
Yes, so genetic testing can be very helpful, but there are definitely some things to keep in mind when you're thinking about whether or not it's something that's right for your family. One of the things that we talked about in the other video was that not all genetic causes of epilepsy have been discovered yet. So this means that even if your child's seizures have an underlying genetic cause, testing might not be able to find it yet. Maybe in the future, as genetic testing gets more advanced, it will, but there's still a large number of kids who we can't find the answer on a genetic test. Okay. And the other important thing to know is that even when we find a genetic explanation or a genetic diagnosis for some kids, it does not always change treatment. It does not always alter what the doctor is doing. Okay. And genetic test results are not always straightforward. Actually, the most common way for a genetic test report to come back is what's called uncertain, where there are variants of what are called variants of uncertain significance. And what these are findings in a gene or a set of genes that the lab sees. And there's just not enough information known about what the lab is seeing to say whether this is a benign, completely harmless genetic finding, which plenty of them are, or if this finding might actually contributing to why your child has epilepsy. We're just not sure quite often when we see something on a genetic test. The other thing that I think families don't always realize is that genetic tests now are very big. We look at a lot of genetic information. And when we look at a lot of DNA, we sometimes find things that we're not looking for. So these are things that have nothing to do with why your child has epilepsy. Some examples of this are learning that your child or other people in the family are at an increased risk for certain cancers, for certain heart issues, or even adult onset neurological conditions that don't have treatment. Now, many of the genetic tests give you the option as to whether or not you want that type of information disclosed, but they can't always filter that out. So sometimes you learn some of these things. And for some families, they say, that's great. I want to know everything I can. But some families say, you know what, we already have a lot on our plate. We don't want to know about things that are going to happen 20 years from now. So it's a really personal thing to think about when doing testing. Families will sometimes wonder, if I have genetic testing, can that affect my insurance in any way? You know, if we learn that we're at risk for certain things, or that we're going to have all these new medical bills, how's that going to affect my insurance? There is a federal law in place called GINA, which is an acronym that stands for Genetic Information Non-Discrimination Act. And what this law does is it prevents health insurance companies from raising your rates, dropping your coverage, making decisions about your coverage in general, and also employers from making decisions about your employment. So hiring, firing, promotions, this law protects against that from happening. There are some exceptions to that. This law does not protect from life insurance companies, long-term share insurance companies, and disability insurance companies. They are allowed to use genetic information to make decisions about coverage. So those are things that some families like to have in place prior to pursuing genetic testing. The other important exception to this is the military and in small businesses. So any business that employs less than 15 people, GINA does not apply to them. So the military and small businesses are able to use genetic information to make employment and insurance decisions. And again, as I mentioned earlier, we look at a lot of DNA when we do genetic testing, and we can sometimes learn information about the family. So this might be things like if parents happen to be related to each other by blood, genetic testing can show that. Some families don't expect. Genetic testing can also show if one or both of the parents is not actually the biological parent of the child. So we always recommend that you keep in mind your own family's dynamic when trying to approach genetic testing, because it's unique for everyone.